Hi, everybody. My name is Martha. I'm a relationship counselor and clinical sexologist, and I am with Jacqueline Vanderbilt. She is a counselor in Netherlands. And we have come together because we are passionate about vaginismus. And so we are making a 4-part interview series. Okay, four. Four. And this is the first one. And in this video, we want to introduce a little bit about ourselves and why we do what we do. So Jacqueline, would you like to go first?
Yes, I want to go first, and thank you for the invitation. I'm Jacqueline van der Bilt from the Netherlands. I overcome my own vaginismus, and it was a really shameful, lonely, difficult road to overcome it. And after I overcome it, I talked to other people with vaginismus in a special group in the Netherlands, and they said to me from the tips I gave them or the exercises I gave them with the details, they think they are so nice and they do the exercise and it was a success. So they say you have to do something about with the counseling because I'm a counselor from when I was 19 years old and now I'm 53. So I had lots of experience like that, and then I combine the experience of vaginismus with my counselor who I was. And of course, for when I started, I've got a sort of a mission. So I started with my own practice in 2006, and it became a sort of a mission because I didn't want any other woman to go the same way, the shameful way, the lonely way that I go. And that's why in the Netherlands, I went in the media. And you must imagine that in 2006, there was not a lot of promotion about vaginismus. So I told my story and in the media. And for me, I come from a really small village. And when I was with picture and all in the newspaper and in a woman's magazine, I was really afraid of what the reactions are. And until now, from all the media I did in the Netherlands, I never had one bad reaction because they see that I'm really passionate about this subject, this topic, because I don't want anyone other woman to go the same way as I. And in the meantime, for now, I'm doing this for about 15 years. So of course, it's not only about my own experience anymore. I've learned so much. I made my own method that was is really successful for many women, and I found it really touching that with my own difficult road, I can help so many other women with the same problem. So that's who I am.
Yeah, thank you so much. So
Yeah.
you are a pioneer because you've been doing this for 15 years and it is a long time. So I've been in practice for 12 years and I was shocked when I started my practice. I didn't know what to expect when I started my practice, and I was shocked that in the first 2 years, I already worked with 200 women with vaginismus in the first 2 years. And my supervisor that I went to, who had been in practice for 30 years at that time, said she only has met 2 people with vaginismus, and she's in the US. So I think it's very much a cultural issue. The fact that as Asians, we don't talk about sex and we think that we are protecting our kids when actually they are not being exposed, so they don't grow up being knowledgeable and savvy or even informed about their own bodies. So anyway, I know this is not meant to like go into vaginismus so much. So a little bit about myself. I'm relationship counselor and clinical sexologist, as I mentioned just now. And I have been doing this for 12 years. And I didn't expect to specialize in vaginismus. I really didn't. I would think that about 90% of my clients have vaginismus or unconsummated marriage. And the way I work with clients with unconsummated marriage and vaginismus is very similar. It's just that people with unconsummated marriage, they don't have the same kind of fear of penetration and the fear that people with vaginismus have. And so why I'm so passionate about vaginismus is because I love sex. I love sex. And when I first came across this, when I was learning to be when I was going through my training to in sex therapy specifically, where they cover all the different sexual dysfunctions, I couldn't believe that there was such a thing called vaginismus. And I was like, oh my God, like coming from somebody who loves sex, who enjoys sex, and I'm like, this must be the most horrible thing that can happen to a woman. And I wanted to support women in any way possible, and I didn't expect for this to become my specialization and the calling. I really didn't, because when I started my practice, I didn't know what to expect. So it has really been an honor and privilege to be able to work with so many couples, and uh, be able to see that they overcome it and move on to having baby if they want baby. A lot of them want to have baby,
Yeah.
and it's so paralyzing kind of a condition, because it affects them in so many levels, mentally, physically, emotionally. It just crushes their soul. And so I believe that for you, you know, you have your book, you are in Netherlands, and you told me just now that you are actually very well known. And you mentioned this year that you're coming forward and wanting to speak more. And this is why I love technology, because I wouldn't have been able to meet you if not for technology.
Yeah.
And now that I know about you and about your work, we're doing this interview now so that we can get more people to understand about vaginismus, and get the support, whether it's to you or whether it's to me. It really doesn't matter, because I am also the same as you. I do not want anybody to suffer any longer than they need to. And they are suffering because they are going around and not getting the right support. They are going to the GPs, the general practitioner, they are going to their gynaes, and a lot of times they don't know what they're talking about. And even my colleagues who are sexologists, if they don't specialize in vaginismus, they are also not experts in it. They are also not the best people at times. And then there's physios, unless they specialize in vaginismus, they are sometimes also not the right people. So for those people who already are specialized, who already know a lot, especially for you, you're a counselor, like it's so important, like we get the message out there so that together we can eradicate vaginismus, because it's actually highly treatable.
Yeah, that's true. And I see your passion. It's really nice to see, because when I'm when I'm speaking, I'm always speak also with so much passion. And yeah, for me, it's a sort of the saying that the I found that the women who come to me, they are so full of shame, and they many times they say, yes, I'm the only one, because I never spoke to somebody. And now in the Netherlands, it becomes a little bit more familiar, because there's a little bit more on the television or in the media about this subject. But what I thought, that's why I went into media, is there was only talking about women who still has it. And I thought, yes, but it is possible to overcome it, because I had the worst case of vaginismus and I overcome it. So if I can succeed, then other women can all, because I'm not different than many other women. And that's why for me, when I was coaching older women, and I still found that too less women come to me or ask for help. So that's why I wrote my book. So it's translated in English. It's how to overcome your vaginismus. And because I wanted to be it real easy to get some knowledge of me and some experience of me, because the book is full of knowledge about vaginismus, and it's all step-by-step plan. So you can do it by yourself, and many people do it by themselves, and sometimes they ask me for 1 or 2 coaching sessions, and some people want me to do the whole thing with the book. And the whole book is underpinned with all my own experience and the experience of the woman who I coached. So when you read the book, it's the way I talk is how I wrote the book. And yeah, so that's I wanted to write this book, because then so many other women can find some recognition in my story or in the stories from all the other women, because so many women feel so lonely and so ashamed. And yeah, and every time when sometimes I get some mails or some WhatsApp messages, and in detail I get that it succeeds, that the intercourse is succeeded. And then I felt so touched because I can help them with my own experience. It's really lovely for me. And after that, we can talk a little bit how it can be nice with intercourse, not only that it is possible, but how you can have pleasurable intercourse and everything in sex life.
Yes.
Um, but that is why yeah, then I think I have the most incredible job, even if it is such a vulnerable subject to talk about.
Yes, thank you so much for sharing. So for those of you who are watching this video who are actually still confused and not sure about what is vaginismus, so in a nutshell, vaginismus is a condition that happens when the vagina shuts down, making penetration difficult or impossible. And it is a psychological fear causing the physical tensing of the muscles. Jacqueline, do you have another definition?
Oh, what I found is that many women who also has little wounds on the, I always do it with my fist. If they have little wounds around the vagina opening, then many times it also calls vaginismus. But if there are many wounds or just one wound, of course the penetration is hurtful. And
Yes.
what I found out is that many women go on, go on, go on, even if they have pain, and then later on they can have also really cramped pelvic floor muscle.
Yes, so
So
they can
sort of two different kinds of yeah,
vaginismus.
the reaction sort of in the time is the same, but the cause is really different.
Yes.
Yeah,
So what causes it is different. So there's primary and secondary vaginismus. Primary
yeah,
is when you've had this your whole life, and secondary is when it happens afterwards. Like what Jacqueline mentioned, it could have been because of a wound or a tear, and then it causes more and more fear and pain because the body has its own wisdom and reacts to that, and so that can be a secondary vaginismus. So this is the first video, and we are going to go on to the second video. So in the second video, I'm going to interview Jacqueline on her treatment. In the third video, she will interview me on my treatment. And in the fourth video, we want to talk about beyond vaginismus. So stay tuned and tune in to video number 2.
see you.
Okay.